Thank you so much, Premier. Thank you, Minister, for I guess, demonstrating the faith you have in us this morning, and historically. Premier, have a long history of being right behind the medical research sector in this state, and it's a big reason why this state is a world leader in medical research inside and outside of infectious diseases. So thank you so much for that past, and especially the faith you're putting in us today. Thank you to Duncan, Vice-Chancellor of the University of Melbourne, to Sharon, the Director of the Doherty Institute, and for your partnership, but also for what you represent, the partners who are also in the room today and those who are not, from the Walter and Eliza Hall Institute, from the Royal Melbourne Hospital, from the Murdoch MCRI, Murdoch Children's Research Institute, to my partners on the campus I am at the moment who remain very close to us, Monash University, to the Alfred Hospital. We are partners who work together in all times, and most certainly during emergencies such as COVID-19. We're very close colleagues. I think we get painted as competitors. We're actually very close colleagues and friends, in fact. So I know we all are very excited about this next step of taking that partnership one step, very significant step further to achieve more. Just a few words about the Burnet. The Burnet is an infectious diseases and public health institute born out of the Fairfield Hospital some 35 plus years ago. So infectious disease is, of course, our DNA. But so are issues of disadvantaged communities and poverty. We've seen how infectious diseases has a habit of targeting those, especially COVID-19 shone a very big light on that. And as Sharon's alluded to, we are very regional in our presence. Infectious diseases don't recognise any borders, state borders or international borders, of course, and again COVID-19's shone a very big light on that. Surveillance is very important, detecting infectious diseases as they emerge, the earlier the better, and of course regional countries' capacity to deal with their own problems for the benefit of their own communities as well as for the global community. Burnet is very focused on that. Our issue has been, we, like the Doherty and the University of Melbourne and all our partners, tackle problems that are bigger than us. And that's what this initiative is about. How can we work to address very complex things more in partnership, more geographically together. Critical mass does matter. The world's great centres in this space are geographically together to a large extent, and the governance model that we will adopt to operate in partnership. The result will be a much better capacity, and I do agree with Sharon that our response, Australia's response and Victoria's response to COVID-19 has been extraordinary, absolutely extraordinary by any global measure. But we will face future challenges. We could face even worse challenges, and we've still got very big ones today. Pandemics of the past that are still with us, HIV, TB, malaria, for example, as well as, of course, of COVID-19. This is an opportunity, this will safeguard Australia and the region much more than the capacity we currently have, and it will, in ways you've heard, be an economic and jobs driver as well, both indirectly through less disruption and directly in creating industries of the future. So Burnet in particular, who's going to move into this wonderful new facility, is incredibly excited, but I know I speak on behalf of us all to say this is an absolute red letter day for this community and for this nation. Thank you.